Good morning, everyone. This is Patrick Jones, your fearless facilitator, coming to you live from North Spokane. Welcome. We're going to get started here in a couple of minutes because we do have a jam-packed agenda. And I just wanted to see whether there's any quick questions among the group about what we're after today, and also if there's any sort of housekeeping or technical questions that we might be able to clear up here before we start with the presentations.
Coordinators.
Okay, hearing none, we will.
Patrick, it looks like you muted yourself, or you're self-muted. Oh, there we go, sorry.
No, I did that on purpose. So. Okay, well, let's get started. Again, this is Patrick Jones from Eastern Washington University, and welcome to the second annual Leadership Council meeting in which we report out from our local health improvement networks. By way of background, the local health improvement networks were really a consequence of quite a bit of discussion at the board level, at the inception of the ACH about how to handle such a big geographical span that we have in the Greater Columbia ACH, which implies that there are lots of individual or localized issues that probably need to be addressed in some form or fashion. And I think for those of you who have been involved in the ACH for a while, you know that to some degree, the funding that the ACH has been able to dispose of has been more or less prescribed by the healthcare authority for the transformation projects. And so despite that, the board and certainly Carol and others thought it would be wise to try to at least address what seemed to be differences across the 9 counties that the ACH covers. And the local health improvement networks were born out of that thought and inspiration. So this past year, as in the prior year, about $1.4 million have gone to the different networks. And what we're going to do today is hear from, first of all, the administrators of the funds that have been allocated out of that $1.4 million, the third-party administrators. And then we will also hear from probably one recipient or grantee from each of the areas that has worked with the third-party administrator. So one of the, I think, overarching goals for the LINs has been to address something that really wasn't part of the menu of activities that came from, that really have been handed down to us by the HCA, and that is to look at the upstream effects, the so-called social determinants of health, and I would, as an economist, add the socio-economic determinants of health. And to a large degree, the LINs have been addressing these upstream factors, and so some of those are quite fascinating. And I'll just say, as the facilitator for a few years here on the Leadership Council, I found last year's meeting at Benton Franklin United Way fascinating, as we heard from all the different, not all the different, but many of the different grantees across the region. So the format today is much the same, obviously different because we can't see each other live, or not live, but face-to-face or person-to-person. But we think it'll work fairly well with Zoom. And you can see in front of you that Chelsea's put up a pretty packed agenda. So I would just ask the presenters to stay on target with the time. And I know that to help you out with this, Chelsea will be putting up just a little reminder about where you're at in the allotment that you have in your presentation. And just in terms of housekeeping, we'd just like to ask everybody to mute their computers or mute their phones, if possible, when you are not speaking, just to cut down on the background noise. It's wonderful to see that we have this many people on the line. We've got close to 85 right now, and who knows, that might jump up a little more as we get started. So our Are there any quick questions about the format today? All right. And Ms. Moser, are there any comments from the ACH staff or quick announcements that you would like to make?
Not for me, Patrick, unless Wes or Diane have anything that they need to announce.
Diane, Wes? Okay. Well, maybe they're still trying to unmute themselves. So batting first in the lineup is Kirk Williamson from Benton Franklin. And Kirk, you've got, as you see here, 10 minutes, and I know that's not a lot, but I'm sure you can manage to squeeze in quite a bit of information in that time. So Kirk, the floor is yours.
Thank you, Patrick, and good morning, everyone. As you can see from our slide, this is one of the more visible things that our group has accomplished over the last several months. Our Behavioral Health Committee took this on. There are sets of these signs. We actually purchased 1,000 different signs in English and Spanish, and they are literally all over our community. It was interesting to us. I believe that plagiarism is the most sincere form of flattery. We have had organizations from Bethel Church to others ask if they could either sponsor signs or if we minded if they put up similar signs with their own message. And we've asked them to kind of stay on target. But other than that, you see you'll see the results as you drive around town. Next slide, please. Just a quick reference of who we are and where we are. We're right in the middle of the ACH. The Health Alliance started in the middle 90s out of a need to get the hospitals a way to work together to build a cancer center task force. After that happened, it was obvious that there was some real power in that organization. And over time, it has morphed to become the Benton Franklin Community Health Alliance, which is also the LIN for Benton and Franklin counties. Next slide, please. Well, I think that headline speaks for itself. We responded by moving just about everything to remote or virtual meetings. You can see there an agenda in the lower right for last month's full alliance meeting. We have regular committee meetings, and then the full alliance comes together to sort of bring it all together once a month. And those pictures are just at random screenshots, really, from our presentation or from our various meetings. That's Dr. Farian Williams in the upper right in front of the WSU backdrop. That is, he's talking about some plans for a mobile clinic to be used throughout the region covered by the Elson S. Floyd School of Medicine. And we're playing a role in helping to make that happen. Dr. Person is in the middle. She is everybody's favorite punching bag these days over whether or not whatever you care about can open or not open based on the COVID. Our Human Services Coalition has been working on food insecurity, which is one of our major points of emphasis. Right now, they're learning from the Kennewick School District, or just finished a meeting with Kennewick School District's food service. Right now, all of the food that they have is going into the hands of people who are using it. But when school's in full session, there is a fair amount of waste. And we've been talking about ways to get that unused school lunch material, not off the plates, but out of the serving dishes, into the hands of and mouths of people who can use that food. Our Patient Safety Committee is working on transitions of care, which is one area where we think things go wrong and people wind up being readmitted to the hospital or otherwise in conditions that are not optimum. So we've been working on that. We did a failure mode effects analysis on that. That's just concluding effects. We're wrapping it up this afternoon. Next slide, please. We've also revamped our website, as you can see, and there are the 4 blocks in the middle are some new additions. The one on the far left is the latest of a series of webinars that we have done on Zoom, and we're averaging around pretty close to 100 viewers for each. That started with a conversation from the Youth Services, or excuse me, Youth Suicide Prevention Coalition about how to talk about suicide, because we know there are safe ways to talk about suicide and not so safe ways that are triggering. So we did an hour-long webinar that was attended by about 150 people on talking about suicide, featuring Kimberly Starr, who is a Prosser mom whose son died by suicide a couple of years ago, and she's a very effective speaker. Our second webinar was on entitled "What You Need to Know Before You Need an Ambulance," and was particularly targeted for people who are either keeping track of elder parents or and that sort of thing, or may need an ambulance themselves. And it was all about the physician order for life-sustaining treatment, the pulse, other ways that people can prepare, not for the ambulance visit today, but for the one that might happen 3 months from now. Again, we had about 100 people attending that. Our next one was addiction and recovery in the Tri-Cities. That's an open question that we're continuing to work on. And the next one is in planning stage, but it's surviving the COVID winter, and it's especially a survival guide for parents whose kids are either in hybrid learning models or who are learning at home. We have a retired kindergarten teacher. We're going to add a school psychologist and perhaps one other person to that group to do a webinar really targeted things like classroom management in the home. If you know, teachers spend a fair amount of time learning and practicing classroom management, and some of those skills should translate to home pretty well. Across the bottom of our website are the 3 challenges that were surfaced in our local community health improvement plan, actually in the needs assessment from last year in the health improvement plan. Next slide, please. Dr. Person and I meet weekly, and when we went to Zoom, we thought, well, geez, there she is. It's hard to get on her schedule these days. She's very busy, but when we do have time, once a week, we record a video, she and I. It's co-sponsored by the Columbia Basin Badger Club, and it's usually 3 to 5 minutes long, and we get her to talk about what's going on with COVID and what might be going on over the next few days. And it's been very popular. We post it on our website as well as the Badger Club's website, so it gets out to a reasonable number of people. Next slide, please. That's the message of the day for everybody, and those that's just one of several things that the Behavioral Health Committee is doing. They're also working on developing a version of Men in the Middle, which is targeted for middle-aged men who are most at risk of suicide. It's based on a program in Walla Walla, and I'm pleased that Peggy Needham and I are meeting next week to learn a little bit more about how to spin that up for Benton and Franklin counties. Next slide. This looks a little bigger than it is in real life. If you saw it in real life, you'd realize that it's actually 6 panels that fold up so tight, thank you, that fold up so tight that they fit in a wallet. It's about the size of a credit card. You can carry them around, and it has information about what to do if either you or someone else is in mental health crisis, and has quite a little bit of good information. Next slide. Next slide, please. One thing that our Alliance has been supporting for the last couple of years is a state work group on the need for a confidential tip line or a phone line service that allows a student, a parent, somebody to report things that are happening in school that might originally be a threat to a school or to somebody. I was a member of that task force, and we just finished our report in July, and it will go to the legislature in January. Next slide, please. I'd be happy to talk about that sometime when you have a little more time, because I can talk for a long time about it. Community Improvement Plan, as you can see, went through quite an exercise, both with the creating the Community Health Improvement Plan, and before that, the CHNA, which allowed us to give priorities also to the Three Rivers Community Foundation, the third-party administrator that did the work to actually make sure the money wound up in the right places. Once we made the recommendation, they handled the rest, so there's some separation. And it's my pleasure to introduce the executive director of the Three Rivers Community Foundation, Abby Cameron. Abby?
Good morning. Thank you, Kirk, for that wonderful introduction. I'm really happy to be here with you today. My name's Abby Cameron. I joined Three Rivers in December, so unfortunately, I didn't get to be a part of this grant process last year. I've really enjoyed getting in contact with our grantees and learning about the work that's been spurred by these dollars. Next slide, please. As Kirk shared, the Benton Franklin Community Health Alliance did all their good work to outline the social determinants of health to feed into our grant process. And as he shared, those were housing with an emphasis on addiction and mental health issues, food insecurity focusing on youth, and mental health focused on improving access to services in our area. So those were our marching orders, and we used those in our grant process in 2019. Next slide, please. So through GCACH, Three Rivers received $434,000 in funding. We received grants for requests for almost double that. So always a difficult process. Ultimately, through our board's decision making, we awarded grants to 6 organizations working on those issues, and I will share a little bit more about each of them. Next slide, please. So one of our grants went to communities and schools of Benton Franklin. The program was called From Homeless to Housed. Through this program, they were providing one-time housing assistance vouchers, typically around $500, and they partnered with 2 other local organizations as well to identify folks who needed that assistance. To date, they have helped around 50 families. They one thing that they shared that I thought was very interesting is their site coordinators are in touch with families regularly. They're in, quote unquote, in the schools as much as they can be. They're finding that families in some cases are not prioritizing back rent and things like that, because especially over the summer, there was so many changes to the eviction moratorium and when that was going to expire, and maybe there would be more assistance and things like that. So the site coordinators are finding that they have to be very proactive in making sure families know that this assistance is available, so they don't just think, oh, I think that's going to get taken care of, or I won't have to worry about it. And so they're being very proactive. Couple of individual stories that this program supported. A parent who is a single dad with 2 daughters, not receiving any child support, and the family had been living with roommates. The assistance they received helped them with the deposit and partial rent for an apartment for just the 3 of them, finally granting the family the safety and independence of their own home. In another circumstance, parent needed help with a deposit for new housing after the family lost everything in a house fire. This assistance allowed the family to be quickly rehoused and for the site coordinator to focus on working with other community organizations to help with furnishings and household items. And in a third case, the family received support to assist with back owed rent. The mother, who's the sole provider for the family, had lost her job in December due to having surgery for thyroid cancer. Unemployment benefits had run out and the mother was unable to find a job. Receiving assistance on the back rent allowed the family to keep their home. And just noting that when they are providing these funds, they're often turning them around within the same day or within 24 hours. So really, truly immediate assistance. Next slide. Another project that these grants supported was through Community Action Connections in Benton Franklin. Lourdes had the opportunity to gift a 10-unit mobile home park to the organization. The original intent prior to COVID was that these 10 units would offer temporary housing for families who were transitioning to permanent housing. However, after the pandemic began and the ensuing economic impact, the program was adapted to offer, in some cases, permanent housing. Unfortunately, in March, one of the units burned. So they have 9 units in use. And the program has, since it started in both the transitional housing and permanent housing, supported 49 individuals through those units. Next slide, please. Grace Clinic, another one of our grantees. The goal of that program was to hire a psychiatric nurse practitioner for the clinic. This is chaplaincy. Change that title in your mind. It's chaplaincy healthcare, pardon me. Chaplaincy Healthcare was hiring a clinical social worker to provide behavioral health services to the Medicare population. Oh, you're so good to actually change it. Thank you. Chaplaincy Healthcare. Noting that the Medicare population is underserved in behavioral health services. Hiring and filling the position was delayed due to COVID, but the position was filled in July and has provided the majority of their service hours to this population, 110 service hours so far. Providing those services both through telehealth as well as some in-home visits with precautions and working closely with the palliative care program. And they are certainly seeing an increase in referrals as the shutdown has continued and people have been isolated. So that is chaplaincy. Thank you so much. Next slide. Tri-Cities Residential Services, their grant was to participate in a peers training program for 2 of the staff of Tri-Cities Residential Services to participate in that training and then bring the program back to their residents and provide social skills training for residents with autism and mental health issues. Unfortunately, the training was delayed due to COVID. They were waiting for the training to be offered virtually, but just in, I believe, September or early October, they were able to participate in the training. Excuse me. The training costs were less than expected, so they are going to divert the remaining funds to cover the scholarship and material costs for their residents to participate, to make that very easy for them to participate. One of the really cool things about this program is the program's very adaptive to the client's needs. So it is a kind of a full package of social skills training, but depending on what support the individual needs, they're able to customize what they're delivering and be efficient in that. So happy to hear that. Next slide. Catholic charities. Before we get to them, I have one update that's not on a slide, and that is from Grace Clinic that I mentioned earlier. Their grant was to hire a psychiatric nurse practitioner for the clinic to increase their ability to provide those services. And in addition to partner with WSU Tri-Cities to precept some of their psychiatric nurse practitioner students at Grace Clinic to increase the number of professionals who are trained locally and increase their ability to provide services. Overall, that program has been delayed, but they will be starting it in February in line with WSU Tri-Cities schedule. So now we are on Catholic Charities. Their grant was to provide peer support, to hire an individual to provide peer support in their 3 affordable housing communities. The position was filled before COVID, but was intended to provide a lot of these supports in person, and so had to adapt to phone contact. Families through this have received an average of contact to 3 other organizations to fill needs that each family has. And in my last few minutes here, I'm really happy to have Sandra Aguilar and Ruby Alman from Catholic Charities, who I hope are both here and can unmute. Sandra, if you would share a little bit about the shape of the program, and then Ruby, if you would share 1 or 2 stories of the residents that you've been able to assist, that would be wonderful.
Yeah, hi Abby, and hi everybody. Thank you so much for having us here today. I wanted to share that Ruby has been doing an excellent job on the ground serving our Rio de Vida housing site and our St. Anthony Terrace housing site. And basically, she's providing peer support services to 50 families at our Rio de Vida housing site, which mainly serves farm worker immigrant community, and then our St. Anthony Terrace housing site, which serves elderly individuals. And so her effort and her work is to connect people to health services and to ensure that they are thriving. And I'll let Ruby share a couple of stories. I want to share that today she's connected roughly around 225 people to services and has managed to leverage around 16,000 in funding through connecting people to rental assistance, that folks that have contracted the virus or have fallen behind on their rent. And because of contracting the virus, that they've their hours have been reduced at work, and they've been needing additional help and services. So I'll be quiet now, and I'll let Ruby share some anecdotes and anything else that she'd like to share.
Thank you, Sandra. Good morning, everyone. We have really focused during the virus to empower our residents and peers during these difficult times. We work to connect them to health resources, but also financial and other resources in the area. There are a couple of stories of our residents and peers I would like to share. 2 of these stories are from our farm worker community at Rio de Vida, and some of these stories are from our residents at St. Anthony Terrace. When I first, or when COVID first began, or the pandemic began, I partnered with one of the families at our farm worker sites. Unfortunately, a family had become sick with the virus, which really affected their work and their financial stability. I was able to connect them with health resources and financial assistance, including rent assistance. This helped to empower the family overall. I also assisted another family where we worked together to find a provider for his daughter's surgery during the virus. We were also able to work together and assist the family financially with clothing and food during this time. At our St. Anthony Terrace, we had where I worked with one of the residents who was having surgery, and we really worked together to explore the resources in the community that there were available to her to assist her with her recovery. And lastly, another resident at our St. Anthony Terrace site, we connected her to mental health resources in the area. She is one of our peers that currently is working through or suffers from dementia. So we really connected her to the resource that she felt most comfortable with. So overall, during this time, we really worked to empower these communities during these difficult times with the resources in the area. As Sandra mentioned, we've been able to connect quite a few families to services. I've worked with around 225 families in the Prosser area from the months of April and October. We partner with other organizations such as our Parish Program, OIC of Washington, and Washington Solidarity Immigration Network to empower these communities.
Thank you, Ruby. Just wonderful work, and I understand the challenges you faced in having to adapt your work to make these residents aware that you were there to support them through phone and other ways of contact. So just your perseverance clearly has paid off, and you've provided tremendous assistance. So thank you.
Thank you.
Thank you, Sandra and Ruby, for joining us this morning. And right on time, last slide, please. That's just my contact information and my cell phone number. Yeah, weird 202 area code. I used to live in Washington, D.C. Thank you for having us here today. It's really been wonderful to be a part of this program and see the impact that it's had in our community. Thank you.
Thank you, Abby, and I hope you and Sandra and Ruby will stay on the line as we march down more very fascinating reports from the field. The next one is from Amy Osterman from the Community Health Partnership. Amy, you're on and you've got 10 minutes.
All right. Okay. So hi, everyone. I believe this is the first leadership meeting that I have attended. Usually these were attended by Megan DeBolt, who was our director here at the Walla Walla County Department of Health. Megan's last day was Friday, October 2nd. So I've been in this position that I'm in now, coordinating the Community Health Partnership since June 1st under Megan's tutelage. So I'm quickly trying to come up to speed. So I'll give you a little bit of an overview of that, but bear with me as I learn my own Community Health Partnership and the ins and outs of that. So go ahead, next slide. All right, so 2020 activities for our Community Health Partnership. So yeah, we had a coordinator change and a new coordinator as of June 1st. Prior to that, through the end of 2019, we had Morgan Linder, who was convening these meetings also with Megan DeBolt. That position that Morgan was in was discontinued, and we had 6 months where Megan was pretty much doing it all by herself, and then we were able to reinitiate the coordinator position and bring my position on, which is actually as the department's epidemiologist. So silver lining to COVID is that we had that position open here, kind of a weird year. But that's wonderful. Now we have the capacity to re-engage more fully in this work. We have started having meetings of the Community Health Partnership again monthly virtually. We have met in June, July, August, September, and our October meeting is coming up on the 20th. The focus of our meetings has been aligning the community strategic plans, with our focus being early learning, behavioral health, and housing. So there was a gap with our Community Health Partnership that I talked about, a little bit of disengagement. The work has still gone on in the community, especially you're going to hear from the Blue Mountain Community Foundation after I speak. So those projects have still continued. But as far as the Community Health Partnership Group meeting and doing a coordinated effort, we're really in a sort of re-engagement phase. So we may be in a little bit of a different position than some of the other groups that are speaking today. But I can give you kind of an overview of what the group has been talking about, and we'll re-engage around, and then talk about what we've actually been doing currently. So first of all, we had Isla Dawn McClellan, who is from the Walla Walla Early Learning Coalition, reorient us to the Early Learning Coalition strategic plan and their goals and how they are moving to allocate the resources that we have here in Walla Walla to support responsive relationships, strengthen core life skills, and reduce sources of stress. So the group got to learn a little bit more about her plans and their plans as an organization, and really see what the childcare and early learning challenges are in the Walla Walla Valley, which have been, as they have in many areas, sort of attenuated by COVID. So the challenges that we had of not having enough providers, of not having enough providers, especially for infant and young toddlers, those have just continued to be challenges during the time of COVID. And then we have our behavioral health goals. And we had our meeting in August where Peggy Needham, who was already mentioned, because Peggy heads up the Men in the Middle program here, and that's been wildly successful and a great group here in our community, spoke to the group about the behavioral health goals and some of the ins and outs of the department, the DBHR, I'm forgetting it, Department of Behavioral Health and Rehabilitation, I believe, and Healthcare Authority, and what they are monitoring regarding substance use. So that's a big issue. So we have the Men in the Middle program, which is suicide prevention, and then we also have quite a few other initiatives in the community that we're working on around substance use. We've got our CPWI, working with especially Walla Walla Public Schools. Then we have got our youth marijuana prevention program where Walla Walla holds the regional contract, and that was my former position with the agency. For about 2.5 years, I was the youth marijuana prevention and tobacco prevention coordinator. So very familiar with that. So we brought the group up to speed on that. And then at our most recent meeting, we had an opportunity to come up to date on our housing programs that are going on pre-COVID and during COVID. So Walla Walla as a community has been working to deal with our homeless population. We've been working on our homeless camp that we have. So we've been dealing with long-term adult homelessness. We also have been dealing a lot with the Anchor Initiative and our youth housing issue. And we have brought on during that time Samantha Jackal. And Samantha spoke to our group about the 5 grants that she's been working with during COVID. So the Emergency Housing Grant, the Eviction and Rent Assistance Program, the Community Development Block Grant, the Emergency Solutions Grant, and the Shelter Grant Program. And all the money that has brought into Walla Walla, but also the logistical challenges of trying to operate all of those grants at a small community with the capacity that we have. So the takeaway from all of these and our group meeting is we have one more meeting about housing where we're going to talk about affordable housing in general, which in Walla Walla is a big issue in our county because as we have grown into more of a tourist community, we have a 0 vacancy rate. And we have a 0 vacancy rate, and compared to our median income, quite a high price of housing. So that's been an issue for many years. And so we are orienting on that and figuring out kind of where we want to go as we develop our local health improvement plan and update our 2019 plan based on kind of where we're at now, the changes that have been made to staff and capacity during COVID, and all of that. What we have been focused on as we get reoriented as an boots on the ground strategy has been our mask distribution and getting masks out to all of our community organization. Oh, thank you, 2 minutes. So we have distributed currently 16,000 masks. Our emergency management coordinator, Jody Ferguson, who used to, if any of you were aware, she used to do oral health as well. Now she's full-time emergency man. So our division continues to undergo change and growth. And it's wonderful because Jody has a lot of skills in that area, and she's really been able to reach out to the community partners. So I have some notes on that. Hold on a sec. So we have both the KN95 and the cloth face coverings. I think we had 50-some thousand masks. Many of them are up front in our lobby. We are continuing to work with our community partners to get those out. This is especially important right now because Walla Walla is just behind the Tri-Cities area in opening up our schools. And so we want to make sure that students, teachers, everybody has face coverings and masks and PPE that they need to move into this next phase of opening. So really that has been consuming our time, and I look forward to, as we do this next phase of opening, getting the group together to really make some plans about projects that we can expand and get the subcommittees working on in the second half of 2020. And that's all. I think next slide, if there is one, yeah, questions. So I think that we are ready to go on to Greer Buchanan and the Blue Mountain Community Foundation. So thank you so much.
Thanks, Amy. Hi, everyone. I'm Greer Buchanan. I'm the grants manager with Blue Mountain Community Foundation, and I have sort of a similar disclaimer at the beginning of my presentation that our executive director, Carrie Isaacson, a name you probably recognize, retired on September 30th. And so I'm stepping into her shoes for this piece of what she used to do until we have our new CEO and president starting December 1st. So I hope that I can cover the information that we're all hoping to hear. I mostly have stories from our grantees. We received 2 different GCACH grants. The first one I'll start with is the Walla Walla and Columbia County section. We received about $134,000 to redistribute as the TPA to our community partners. Next slide, please. So I included a map just because I have 2 different grants to report on. I wanted to be sure that our areas were kind of clear. So for this one, I'm reporting out about partnerships in Walla Walla and Columbia County. Next slide, please. Okay, so we distributed $18,000 to our partners at Columbia County Health to support the purchase of a transport van. This grant was one of 4 that we distributed to this particular project through various funds that we had here, including the second phase of our GCACH funding that we'll cover in my next section. So the point of, or the social determinant of health for this was reducing barrier to healthcare. The total cost of the van was $69,500. So between the purchase of the van in October of 2019 and when I received the report in May, they had made 110 transports. 32% of those were social work related, 54% were acute care related, 12% wound care related, and 4% for physical and respiratory therapy appointments. And these are all for, obviously, clients who lack transportation. Their transportation went as far as Spokane into Walla Walla several times. I have more of those details for the next my next report out about the same grant. Some of their plans for the future, they've realized with this reliable means of transportation that they actually could increase to a fleet of 3 vans. So they are working towards that. And next slide, please. All right, another grantee was the health center here in Walla Walla. This is a student health center. They serve ages between 4 and 19 with no charge to the students. So all income levels are welcome. We supported them through general operations with the social determinant of health to reduce barriers to healthcare. They report seeing students identifying as LGBTQI. They see students on the autism spectrum. For the reporting period for this particular grant, they reported 5,285 students served. You can see the breakdown there. They have it broken out by behavioral health, group counseling, classroom presentations, care coordinator interactions. Those are counted as things like just stopping in and saying hi, dropping by the health center. They have a bathroom in the health center that is a private bathroom. So they count students who come in, say hi just to use the bathroom. And then medical persons served. So I have a couple stories submitted from the health center. The first one is a medical story. The health center ran 3 flu shot clinics this year, at Pioneer, Garrison, and Wahai. So those are 3 schools. Pioneer and Garrison are our middle schools, and Wahai is our high school, one of our high schools. A parent of a middle school student requested that her child receive a flu vaccine, but was concerned because the student doesn't like to be touched. THC care coordinator suggested going to the student's life skills classroom, which is safe and familiar instead of the student coming to the unfamiliar health center office. The care coordinator was able to administer the flu shot, made the student laugh, and even received a hand-drawn thank you card from the student. And then a mental health story. THC mental health counselor had a student referred to services because the student missed the entire first week of school due to anxiety. After working with the counselor during one of the last sessions, the counselor asked the student to create his world in the sand tray. The student put his THC counselor, school nurse, and teacher in a building with a dragon looking through the window. The student described the dragon as his anxiety, and he sees it as something separate from himself and that doesn't make him a bad person. The student has since not had any attendance issues since completing counseling, although he still stops by the health center to say hello and grab a piece of candy once in a while. Next slide, please. Helpline received a grant through this program for screening and referral services, again to reduce barriers to healthcare for our community. Helpline reported 12,244 referrals to 132 different programs available, and 4,671 individuals served by those referrals. Of those individuals, 23% are homeless. We have 62% reported as Caucasian, 31% as Latinx, 3% Black, 4% other, 32% were children, and 5% were elderly. So the story that Helpline shared, you're looking here at a picture of Celia, who is the Helpline client, one of the Helpline client services manager. So a global pandemic was not something Celia ever expected when starting her position in January of this year. With the temporary closing of our physical site, Celia has adapted her method of aiding our clients from in-person conversations to the telephone. Daily communication with the rest of the Helpline staff keeps Celia informed of Helpline and our community partners' updates, as information has been changing rapidly. This enables her to keep clients informed. The community effort is heartening. Celia states, "We are so blessed, and I'm proud to say that I'm from Walla Walla. The way all our surrounding organizations have teamed up and worked effortlessly to keep providing services is amazing. Job loss, food insecurity, and financial help with utility expenses are always at the forefront of our clients' worries. Right now, however, uncertainty seems to overshadow them all. Besides referring clients, I've noticed that what they are really looking for is support. They want to know someone is listening and that we will come out of this together." Next slide, please. All right, Providence St. Mary Foundation and the Good Samaritan Program received a $25,000 grant, again, reducing barriers to healthcare. The Good Samaritan Program is a direct patient assistance program through the hospital in Walla Walla, Providence St. Mary's. They reported impacting 193 people, providing direct assistance for transportation, food, prescription, or over-the-counter medicine, lodging, garments, utility bills, and durable medical equipment. They also, this year, have included hand sanitizer, hand warmers, face masks, which were handed out in public locations at bus stops, community shelters, and the sleep center. I have a story to share regarding the impact that this fund has made on the life of a man named David. He's a 60-year-old male, and he lives with heart failure. He's unemployed and homeless. His story is all too common. He worked as a roofer until he became sick. Loss of employment meant loss of housing. Last fall, he was readmitted 5 times in the span of 3 months related to exacerbation of his heart failure. During his last hospitalization in December, members of the population team, Christy and Amanda, met David. After introductions, Christy and Amanda started asking David about his story. Using the guiding principles of trauma-informed care, they asked him what mattered to him instead of what was the matter with him. They learned David is married and he has a beloved cat he calls Kitty. They discovered he lives under a tarp with sticks for reinforcement and has trouble seeing his medications in the dark. They asked what they could do to ease his way. He mentioned a headlamp that would help him navigate his way in the dark as he tried to find and open his pill bottles. He expressed how cold it was and worried about the long winter. He carries guilt that due to his heart failure, he can no longer work physical jobs to make money. The Good Samaritan program provided David basic necessities, including a headlamp, flashlights, and a warm sleeping bag, and cat food for Kitty, along with a scale and a blood pressure cuff, essential equipment to manage his heart failure. He also received customized heart failure education to manage his disease. Since he received this help, David has managed to stay out of the emergency room and the hospital. Next slide, please. Sunbridge Dental Clinic, support for general operations at around $19,000, again, reducing barriers to healthcare. Sunbridge provides dental service to 63% Walla Wallans, 20% College Place residents, and 17% from our outlying communities, including Dayton and Columbia County. They serve 54% female, 46% male, 93% adults, 7% are under the age of 20. 60% have Medicaid, and 40% are uninsured, and 80% identify as single. Thank you. Again, I have a story. I just find that stories are the most powerful way to communicate how we've made a difference together. So the story here is, while many people view dental care as something of a luxury or non-essential benefit, dental care professionals often work with patients who are facing life or death health situations. Our dental clinic manager is very familiar with this phenomenon. Sunbridge's dental clinic seeks to serve patients who do not have the resources to obtain dental care. One such patient is someone who is scheduled to have a multiple organ transplant in Oregon. Before major surgery, doctors try to minimize the risk of infection, and that often involves dental procedures. This patient had been waiting 7 years for the organ donation, and that made his upcoming surgery possible. His problem was that he needed the dental procedure done immediately, and that's where Sunbridge came in. Friday was his deadline. We got his procedure completed Thursday night. With 7 years of waiting for this transplant, the man couldn't miss the deadline. Otherwise, he would have been back to the bottom of the list. And next slide, please. The last grant that we distributed through this fund was to Valley Residential Services for specialized transportation for disabled adults. This van has transported 23 VRS clients, all who have developmental or intellectual disabilities. Oh, my time is up. Okay, I think I made it through all of our grantees. Thank you all.
Greer, thank you so much. And I know we're going to hear from you again.
Yes.
Yeah, it's really hard to encapsulate exactly what's going on to all the different projects that you've, as third-party administrators, funded. So thank you for trying to wrap your arms around that.
Yes.
We're now going to the northwest, to Kittitas County, to the County Health Network there, and we'll be informed by Robin Reed. Robin, the floor is yours.
Thank you, and good morning, everybody. Hopefully you can hear me okay. I'm actually up here in Winthrop in Okanogan County and have a little bit of a spotty internet connection. So let me know if I drop out at all. But
You're coming through loud and clear.
Okay, great. I'm the executive director of the Kittitas County Health Network. I came on board in January of 2019. The Health Network was formed back in 2017 as for a variety of reasons, but a partnership that started doing some care coordination efforts, and they started looking for funding and really decided to kind of broaden their scope into general community health improvement. We got funding to hire staff back in 2018, and again, I was hired in January 2019 and came on board there. So we have a great partnership in our community, and I'm excited to share a little bit about the work that we're doing with you all today. Next slide, please. So we have about 22 cross-sector organizations in our community who have a signed MOU with us, and then another few organizations that are new participants to the work that we're doing. And those organizations range from healthcare to social service, doing housing, transportation, food. We have schools, we have law enforcement, we have substance use disorder providers. We really have a wide range of organizations that we're working with in our community, and looking forward to continuing to do community engagement and get other organizations involved. We have about 70 active individuals that participate in the work that we're doing. As is natural with community engagement, this fluctuates from time to time, but Generally, we have between 60 and 80 folks that are participating in the work groups and the different meetings and the different initiatives that we're working on. So a lot of folks involved, which is really exciting to see. This year, we have about a $650,000 budget. The network to date has been awarded over $2 million in funding. And we started with 0.5 FTE, which was me, and I now have additionally 3 full-time staff on board, and we have several other grant funding that's kind of pending that would require additional staff to do the work. So we're really busy, and we're really moving forward on a lot of great things. Next slide, please. So in terms of our leadership, we have, as a 501c3, we have a board of directors. Our board of directors is made up of 16 members from our participating organizations. And for the most part, our board of directors is made up of leadership of those agencies. So the CEOs, the directors that are there to primarily move forward the work of the network and ensure sustainability and the resources needed to do that work. We have a leadership council with about 20 active participants. And the leadership council is really where the network got started. These are the folks that really came together and said, we need to make this happen, and we need to really formalize our partnership to collectively make an impact on community health improvement. These are the folks that really direct the work and guide the work of the network and determine the direction that we move forward in. Some of the priorities that our leadership is working on right now, we're actually undergoing our first strategic planning process, really looking at, now that we've kind of got some structure underneath us, really starting to look at long-term sustainability. And then also starting to look again at community engagement. When we first got started with the key partners, we kind of hesitated to do too much community engagement because we really needed to figure out kind of our purpose and what we were there for, and really make sure that that was really clarified. And we're finally at that point where we feel like we're ready to start engaging with some other sectors in our community. So that's one thing that we'll be focusing on. Next slide, please. So besides those priorities, the work of the network, our mission is basically to improve population health through cross-sector collaboration and systems integration. And we do this, the mechanism by which we do this is by implementing our community health improvement plan. The Community Health Improvement Plan was created as a collaboration between the network and the Kittitas County Public Health Department back in 2017-2018 through the network's first planning grant that we received. And so the network basically exists to implement that plan. And we have 3 strategic areas in that plan. And the first one is really around improving delivery of services, healthcare and social services in our community. And then we have another strategic area that's really focused around social determinants of health. And then the final one is really around strengthening the collaboration. So we have several different work groups that get together to really kind of be the implementers and implement the work. Our care coordination work group is one of our strongest work groups. And really how this work got started. We have a group of folks called the A-Team that started getting together back in like 2015, 2016 to do kind of informal care coordination for folks in the community. Just found that they had a lot of patients in common and just really worked together to prevent folks from falling through the cracks. So the network is really working to kind of formalize this community-based care coordination system. And through support from GCACH, we're working with the Health Commons Project as kind of the technology platform to help us enroll folks in our care coordination system, do screening, assessment, create care plans, and do warm handoffs to services. We recently received a $750,000 grant through HRSA to implement a rural healthcare coordination program. and just recently hired a project director for that, Alicia Colasurdo, and I believe she's on the call today, so shout out to Alicia. And we're really excited to have some funding to move this work forward. And as we move the work forward, we're really looking forward to expanding our care coordination efforts upstream and focusing on social determinants of health. So really connecting with people before they become, before they're in crisis. 2 minutes, I better get moving. So I'll go ahead and move on to the next slide. Our opioid response work group is also through a HRSA grant, a lot of this work. Just a couple of successes. We're really excited that we've been able to increase our drug take-back locations in our community. When we started this work, we had 1, and we'll soon, I think we'll actually soon have 8 drug take-back locations in our community. So that's really exciting. We've increased our community's capacity to do medication-assisted treatment, and the partnership has really resulted in a lot of great work with the jail, and we've been working on a media campaign. Next slide, please. We have a Resilience and ACEs task force. This task force has done a lot of great work in the past. It's been a little bit stalled due to COVID right now. So we're kind of taking some time to reconvene and kind of figure out how we're moving forward with this work. And I'll go ahead and move to the next slide. Our behavioral health work group has been really busy this year. We've been really trying to advocate our county commissioners to pass a 0.1% sales tax increase for behavioral health services. They've done a lot of outreach. We've met with the Board of County Commissioners several times. COVID really got in the way of this as well. Our commissioners really feel strongly that they need to be able to have an in-person public hearing before that they can pass this tax. And then we're also kind of running into election season with that as well. So we're just trying to figure out kind of how to keep moving this message forward and keep it present in our community. Next slide. And then this year we actually started a child care work group as part of our community health improvement plan. We're hoping for some funding for the Department of Commerce to do a planning grant, to do a planning process. And the exciting part about this is we've actually engaged about 25 partners in this work, 14 of which are new to the network. And that includes multiple child care providers. So this is new work for us, and it's really exciting to be engaging with some new partners on this. And next slide, I think that's probably the end. Yeah, so I'm happy to answer any questions about the work that we're doing. I know that was a really quick snapshot of how we're operating in Kittitas County. And I believe next I'll be passing it off to Sharon with the Yakima Valley Community Foundation and Peggy with the Fish Food Bank to talk about our social determinants of health work. Thank you.
Thanks, Robin. Good morning. This is Sharon Miracle. I am the President and CEO of the Yakima Valley Community Foundation, and I'm filling in today for our Senior Program Officer, Lindsay Boswell, who is unable to be here due to a family medical emergency that she's attending. So I hope to do justice to this, and she's much closer to this work. So a little bit about our organization. We are a community foundation. We geographically are aligned to serve primarily the Yakima Valley. However, we do and have for the last 15 years awarded some small grants into the Kittitas area, the Kittitas County area, because it is very similar to us and they don't have an active community foundation there or philanthropic organization. So we've played this, this role more recently as a TPA for GCACH, and we're extremely grateful for that. It's led to some great stuff. Next slide, please. So about us as the TPA, we awarded $100,000 in the Kittitas County over a 2-year period. And the focus of that was nutrition and housing justice. 99,880 was actually provided. We rounded that up just to make it an even check. And our grantee, the one and only grantee, was Fish. And right after me, Peggy Marash, the executive director, is going to provide details and stories about that. And it's a really, really interesting program. Next slide. So probably the biggest highlight is is truly the increased relationships that we've had. We know that community so much better than we did just a couple years ago, and vice versa. They know us as well. And I can't tell you how important this was going into a pandemic. So we had developed these relationships. We'd been up several times to visit with Robin and members there, and several of the folks who were involved with the original grant applications and things, doing some review work, planning. And then in March, when this pandemic hit, we were able to pick up the phone and see how folks were doing, and they were able to call us and say, help, we don't have a funding source here for pandemic stuff. Can you help? Can you fill this role? What will happen? And so it led to some really amazing work. And next slide, please. So for example, just share how this played out. We established very quickly in March a Resilience and Response Fund, and we did that in partnership with United Way of Central Washington, which serves Kittitas County as well, and the Latino Community Fund. We provide grants to organization now in both Yakima and Kittitas through that fund. It's governed by a 15-member advisory committee, which actually includes a combination of all of those organizations, 2 representatives from each, a board member and a staff person. And then the rest are all community members, including representatives from the Kittitas County Community Recovery Fund, so that we try not to duplicate services or efforts, and really learn where the issues are and where the ongoing needs are, where we see those indicators and where we need to hold back and wait and see what's going to happen, that type of thing. So do a lot of study in that community collectively, and a lot of awarding. So since that fund's been up and running, we've actually awarded 10 different grants totaling almost $100,000 in support of work in Kittitas County. Next slide. So the other piece has been these really interesting partnerships. Robin alluded to one recently. Our organization sponsors the Investing in Children Coalition, and that also is collaborative with Kittitas County. But more recently, we partnered with Robin and folks and went after it's a Department of Commerce Child Care Partnership Grant. And that was in collaboration with Healthier Kittitas. And both Yakima and Kittitas applications reference each other's projects. We support each other with letters of support from each county. And we feel really strong. The feedback we're receiving from folks is that really strong applications. They loved it. And I will just share with you that collective work has garnered enough attention at the Department of Commerce that we were actually invited to be one of their strategic partners in awarding $7 million to nonprofit organizations in Central Washington and beyond. So that's coming up here in the next couple of weeks. So really, really productive relationship there for us, and I think beneficial to that community as well. So thank you, GCACH, for allowing us to have those funds and develop those relationships for strengthening those communities. Next slide, and I think the last. Yeah, so there is the contact information for both Lindsay and myself. And I'd like to introduce Peggy, who's up next.
Thank you, Sharon.
Good morning. I'm Peggy Marash. I'm Executive Director at FISH. FISH is the only food bank in Kittitas County, and we serve the 5 food pantries, 2 of which belong to FISH. The others are independent. We also have a food service division that we call Open Table. A few years ago, FISH began to look at moving upstream, if you will, and looking at more than temporary solutions around hunger, food insecurity, and related diseases, health issues that come from food insecurity. And that led us to an interest in the Food is Medicine program. And we applied for and received a grant to develop Food is Medicine here in Kittitas County. Shortly afterward, the network received a grant for the social determinants of health, and those 2 dovetail beautifully, because it allowed us to expand the Food is Medicine program to include other issues that affect quality of life and the environmental and physical and education, all geographic information, everything really related to the wholeness of our clients and their quality of life. So though we merged with the help of the network and the Yakima Valley, we were able to merge those two grants into one and develop a program that we're really excited about here. We were going gangbusters until the middle of March when COVID put a screeching halt on everything we were doing. And so we are now back up and operating. We are, the Food is Medicine will involve meal deliveries. And within those meal deliveries, we will have trained, our drivers will be trained to go in and make assessments of what they're seeing within the household. Come back to us and we will work through care coordination at the network and through our Care Evantage system, computer system, to be sure that referrals are being made and that people are getting the attention and the care that they need. The program is very exciting to us, and especially because we have the Meals on Wheels contract here in Kittitas County. We're in the homes of the most vulnerable in the county on a regular basis, a daily basis almost. And we do develop relationships. So training those drivers to become certified health workers will enable them, and they're very excited about that too, by the way, adding that dimension to the work that they do. They feel as if they are making more of a contribution to the lives of the people that they're serving, rather than just going in every day, giving them food, how are you doing, and go on about their way. So being able to assess the home, for example, and see if there are not only health issues, but environmental issues that need attention. And all of that comes back to us, goes into our software, and we not only do the referrals, but we're tracking the numbers that we do. We're analyzing data, working with public health to look at the progress that we're making and give it some, some teeth, frankly, so that we know that we're actually having an impact. The wellness, as I was saying, wellness is a very important issue within food pantries, and is really beginning to come to the surface more around the work that we do. We at Fish, our food pantries are part of a Supporting Wellness at Pantries program that ties in with the Food as Medicine and also social determinants, because we're teaching people how to make good choices. The Supporting Wellness at Pantries program, or SWAP, is a program that was developed by a PhD nutritionist to analyze and give value to the nutritional value within foods, and grade them either red, yellow, or green, and help people make determinations of what it is they'd like to take from the pantry. Obesity is a huge problem among food pantry participants, and then the related diseases that come from obesity, hypertension, and diabetes. So we're happy to be able to introduce these nutritional programs and the social value programs within this county. Thank you.
Peggy, thank you so much. Sharon, do you have anything more to add before we take a break?
No, I think I just like to say the fish as medicine, or fish as food as medicine, or Food RX is just such an exciting project. We are thrilled to actually be helping fund that and hear about it, and can't wait to see it as a community pilot project and see how we can deliver that back through Yakima Valley as well. So thanks to Peggy and for all of you at GCACH for your support on that.
All right. Thank you, Sharon. And again, thank you, Peggy. And thanks to everybody who has presented so far. I very much appreciate you staying on point and on time. And so we're actually ahead of the game by a couple minutes, but we're not going to let that keep us back from a break. And so as you see here on the screen, we'll be back in about now 12 minutes, not 10 minutes, but we'll be back at 10:35. So enjoy your cup of coffee, checking your emails, perhaps getting a bit of vitamin D with the sun that I hope is blessing you like it is in Spokane today. So we will resume shortly. Hello, everybody. Welcome back. And we will now start the more or less the second half of our presentations from the local health improvement networks. And as we heard before the break, we are up in the northwest corner of the ACH, Kittitas County, and we're about to travel south and east to the 3 or 4 counties that make up southeast Washington state. And to get us started with that, we're going to have Martha Landman from Columbia County. So Martha, the floor is yours.
Thank you, Patrick. Good morning, everyone. This is Martha Landman. I'm the Columbia County Public Health Administrator and the Garfield County Health District Administrator, and also the administrator of the Southeast Washington Alliance for Health. So a little busy. First of all, we have a new name change. We used to be the Southeast Washington Health Partnership, and when we applied for our 501c3, they didn't like the partnership name, so we changed our name to Southeast Washington Alliance for Health. So that covers Columbia County, Garfield County, and Asotin County. We have monthly meetings, and usually about 20 people. Go ahead and change the next slide, please. We have about 20 people that attend our meetings every month, and Jack Davies is our facilitator of those meetings, and they have been very beneficial to all 3 communities, especially in this COVID-19. I think the biggest benefit we have got out of this alliance is that we all knew each other, and we all had interests, and we're doing healthcare related things before COVID-19 hit. So the relationships were built within the communities and within all 3 communities, that we could call each other and work together on some COVID-19 needs also. And I think that's a big benefit of this alliance. We have, over the last year, we had a health assessment done over all 3 counties separately, and then a combination one. And we were convening meetings to work those assessment activities and the top needs into a community health improvement plan. Combination the goal was to pick out possibly a couple that would be across all 3 counties if we had some similarities, and then each county would possibly have a couple of activities that they would do on their own community health improvement plan. So the top 5 here that came up within the assessment for all 3 counties were overweight youth, immunization, substance abuse, healthcare access, and preventive services, and bullying. So we were working on those in conjunction with Spokane Regional Health District until March, when COVID-19 activities kind of took over our group. So we will get back to those as we are available. Next slide, please. The LHIN funds that we get from the GCACH, Jack Davies is our facilitator, and we pay her with some of that funding. Excuse me. Spokane Regional Health District is who's helping us with our assessments, and have been facilitating that conversation. We also provided dental supplies. It was a grant that we applied for through community health funds that we didn't get, and so we decided to use LHIN funds to give dental supplies to each health department to get out through the community. And it's been a really good dental outreach through the food banks, through schools, just to get supplies out there and be able to talk about the need for dental. And then we also were in the process and had scheduled mental health first aid training for the community members in each community. and actually got the one done in Garfield County before COVID-19. So next slide, please. Right at the beginning, in July 1 of 2019, we got a $100,000 HRSA grant, federal grant that we could, it's a planning grant, and that's help us complete the application for the 501c3. So right now it's been submitted to the federal, and we're just waiting for the final approval, hopefully any day now, from the federal government that we're a 501c3. And very excited about that, and possibilities of additional funding that might help provide us within our communities. Along with the grant, along in the planning grant is, we've done some surveys about telehealth in our communities, and it's very interesting because we did it before COVID-19 of what telehealth looked like in our communities. And now we've just done another one in the last month that we're waiting for some responses on of what telehealth looks like now, and how different that looks, and whether there's more acceptance, and at what level we'll be able to use telehealth. We're looking for something that we could do, maybe apply for a telehealth grant across all 3 counties, and benefit all the communities. So we're still working on the survey results. This grant has been extended through June 30th of 2021. So I'm looking forward to those, to some possibilities there. Next slide, please. We also received a group health grant within our LIN at the end of last year. Before COVID, we received a $150,000 grant over 3 years, and we had defined to use that on mental health in our 3 communities. We're looking at the possibility of hiring a mental health counselor that could be go to the schools and go to maybe a Soton High School one day, Garfield one day, and then Dayton one day, or maybe and that has not got kicked off yet with the money because COVID hit when we were trying to get somebody hired, and it's just put us behind on that money. But we have great expectations and a couple other thoughts that we can use that money for. So we'll get $50,000 a year for 3 years. When COVID-19 first hit, I reached out to Group Health and received $100,000 just to use on COVID, so it's administrative, and we split it between the different communities. So next slide. So in the Group Health in the Soton, we did track phones, we've done car payment assistance, home safety modifications, so rails for elderly and ramps for elderly, and a dedicated driver to be able to do free deliveries to people with that were staying in with COVID-19. Next slide. In Garfield County, we've used it for a summer food program so we could continue the food for the kids after school, and then we added a backpack program for weekends that has never been available in Garfield County. And then here in October, we've handed out basic hygiene kits at the food bank, and we're working on doing it at the senior center and looking for some mental health opportunities. Next slide. And in Columbia County, we've done hand sanitizer right away. We got a hand sanitizer for all our food vendors and food restaurants, and just help them with extra costs because of COVID-19. And then we've done some things at the food bank and the senior center, YWCA, and Project Timothy. Next slide.
And then we have the community health funds that Greer's going to talk about, but these are some just a high level of what we used them for in our communities, and they were just, I can't tell you how beneficial these community health funds were for each community to be able to do things. So with that, I can turn it over to Greer.
Thanks, Martha. Hello again, it's Greer Buchanan, Grant Manager at Blue Mountain Community Foundation. So now we'll talk about our other GCACH funding for the Southeast Washington region. We were the TPA for about $105,000 for that region. Next slide, please. And again, just to provide a visual, we're talking now our Southeast Washington region includes Columbia, Garfield, and Asotin counties. Next slide, please. You'll recognize the van. We used funds here in the amount of $23,750 to again help Columbia County Health System purchase a patient transport van to reduce barriers to healthcare. And I have, instead of going through the stats for that particular project, I have a story. This is from Paul Isle, MSW. He says, "We are getting quite the reputation for caring and service here at CCHS. Last fall, a DSHS caseworker called me to help them connect with one of their clients living in a Dayton trailer park. Their phone calls and letters were not working, and the much needed services were on the verge of being terminated, including establishing a care relationship with our clinic. The patient, having an unhealing wound, needed a van ride to our wound care clinic, which prompted an emergency referral to infectious disease and podiatry surgery in Tri-Cities. On the day before Christmas 2019, the infectious disease doctor in Kennewick asked me if I could provide a ride in the van to Trios Hospital for amputation of an infected toe. The patient has ridden in the van to appointments at the DSHS office to reinstate services, as well as trips to Blue Mountain Action Council for help with housing. Across the past 4 months, he has traveled with CCHS drivers to dozens of appointments in Dayton and Walla Walla and Tri-Cities. He still has both feet. His blood sugars are under control. He still has a home where he cares for his 4 daughters. He has established new relationships with public transport, has been fitted for prescription shoes, and has enrolled in case management through ALTC. He even served a turkey dinner thanks to the Salvation Army and CCHS van transportation. He has had 1 leg cleared of clots and was going to meet with a surgeon to have the 2nd leg treated this week, but instead of driving to Kennewick in the van, he will call on his new phone. The patient has made the statement that our health system saved his life." Next slide, please. Dayton School District received $18,000 to support mental health services. Social determinant of health was addressing family issues. So the mental health counseling services were made available 6 to 8 hours per day, 1 day a week, beginning last October. You can see the list here, the issues that brought students in include depression, anxiety, suicide prevention, bullying, home and family conflict, and alcohol and drug abuse. This program served 36 students between the grades 6 and 12. 5 students were referred for more regular and intense therapy, and 1 student was reporting suicidal ideations. And through the help of this program, those thoughts were eliminated and counseling has continued. Next slide, please. The Garfield County Transportation Fund received support to reduce barriers to healthcare. This fund provides gas cards for patients, and it is a network of groups who provide these gas cards, including 9 agencies in Asotin County, 1 in Columbia County, and 5 in Garfield County. I muted myself. This program was particularly impacted by COVID-19 because medical travel was basically reduced to 0 for several months. So they report distributing 29 gas cards total and anticipate having more demand now that elective surgeries and medical appointments are happening again. The story here is, they say, through this project, we were able to help many individuals from different backgrounds. Clients came in elderly as well as disabled. We were able to help a younger gentleman in his mid-20s who had a work accident and needed gas money to make it to a medical appointment in Spokane. We helped a family that has a disabled child pay for gas to get to a specialist in Seattle. We also helped a lady in her mid-50s who was disabled to go see her husband before he passed away in Clarkston. Next slide, please. Garfield County Food Bank received $10,000 to support access to fresh fruits and vegetables for food bank clients. Social determinant is access to nutritious food. So Garfield County Food Bank served 718 families between July of 2019 and April of this year. 14% in Garfield County live below the federal poverty line, and 51% of the children were eligible for free or reduced lunch. 26% were 65 and older, and 29% of Garfield County residents are considered to be obese. The Garfield County Food Bank administered a survey to clients, and some of the questions included: do you feel like you had access to fresh fruit and vegetables at the food bank? 43 said yes, 1 said no. Is it helpful to have fresh fruit and vegetables available at the food bank? Again, 43 yes, 1 no. And then they were asked to rate the quality of the fruit and vegetables given out by the food bank, and the average score from 1 to 10, 1 being inedible and 10 being fresh, the average score was 9 based on those 44 respondents. Next slide, please. So when we administered this grant to these 3 agencies, this was prior to the formation of the Southeast Washington Alliance for Health. So I imagine these would fall into that group now. But the insurance navigator was funded. Each of these 3 organizations received about $10,000 to fund that position. So Columbia County reported assisting 100 applicants. This program is an established program with that group. They've been serving this need for about 5 years and plan to continue. They've been able to expand their skills. So their insurance navigator is trained now in Medicaid, ACA, SHIBA, and supplemental. Oh, SHIBA is the supplemental insurance for Medicare. They've done insurance outreach at food banks and local community events pre-COVID. And a statement from insurance navigator Delphine Bailey She says, I have had the pleasure of being a navigator for the Washington Health Benefit Exchange since HCA started it. There are many people that I have seen over the years that have been so grateful to have this service right here in Dayton. And they do report an increase in insurance applications with the onset of COVID-19. Garfield County Aging and Disability Resource Center, they have served 15 clients along with follow-ups and connecting those clients with SNAP food benefits, Medicaid. The clients range in age from 19 to 64. They're able to help those clients get health insurance instead of just requiring them to sit on hold. They report increased collaboration with agencies and counties. It helps navigate clients through the system for the health plan finder. It saves clients time and makes them eligible faster. By reaching out to other agencies across the 3 counties to help each other and having points of contact, increasing relationships in the communities and across counties. And then finally, Asotin County Public Health. So they've had some challenges, and we'll just report about them. They haven't gotten, well, as of the time of the reporting, which was earlier this year in May, they had not launched the insurance navigator position according to plan. They had several external factors, including being a very small team that wear a lot of hats. So they do have plans for the future, and it's reported that the plan for the insurance navigator position is to work with, but not be limited to, 450 plus WIC clients seen in our office per month, new transfer into state clients, new infants, foster children, children placed in kinship, and working with our COVID-19 housing grant clients placed in quarantine due to COVID-19. Along with community outreach when SIP, shelter in place, is lifted and refresher training completed. Outreach will include, but not be limited to, flyers and signage for WIC clients, distributing flyers and signage to medical facilities, food banks, courthouse, DSHS, YMCA. The health district also plans to make a social media presence, and information will be placed on the ACHD website and Facebook. So we are hopeful that that program will launch within the next few months, and we'll be reaching out to see if we can support. Next slide, please. I just wanted to highlight our partnerships in this region. I ran out of time on my first presentation for our partnerships in Walla Walla County and in Columbia County, but you can see here we have very deep relationships in both Garfield and Columbia County, providing grants in Garfield County just under $70,000, and in Columbia County around $685,000 just in the last year and a half. We're very proud of our relationships there and look forward to continuing them. And that is the end of my second presentation.
Thank you. Thank you once again, Greer. You're not only right on time, you're a couple of minutes ahead of time. So appreciate that. That might give us a little more time at the end for wide-ranging discussion. So now we're going to move back up the map of the Greater Columbia ACH to Yakima County, going to the west. And we have 2 presenters, Rhonda Hauff and Dan Ferguson, followed by Sharon Miracle once again. So I don't know, Dan or Rhonda, who wants to lead, but I'll let you decide.
Yeah, I think this is Dan Ferguson. I'm going to kick it off, and I'm going to just pull up some notes here really quick. So go ahead and just proceed to the next slide. So Ron and I co-chair the Yakima County Healthcare Coalition, and we meet on a regular basis, usually twice a month. If one of us is gone for whatever reason, we're able to kind of step in and facilitate the meetings. We're going to share with you today our efforts around supporting our masking campaign here in Yakima. We're going to provide an update regarding our efforts to support the Sentinel Network in the care of the workforce, our focus on behavioral health, and then Rhonda is going to talk about our patient activation measure strategies with multiple agencies in Yakima County. So next slide, please. Well, I'm going to go ahead and talk about the Sentinel Network first, I guess. So I'm a member of the steering committee for the Sentinel Network, which is based at the University of Washington for Health Workforce Studies. And because of that, I frequently get some, let's just say, early insights as well as encouragement to advocate for our industry partners and education partners to join to complete the survey to help us understand the needs of the our industry partners particularly. And you can see this is a copy of the website. It's based again at the University of Washington. This is sponsored in collaboration with the Washington State Health Workforce Council, and is actually now sponsored and paid for by the state legislature. So we just believe this is really important. The most recent survey back in May began to identify ongoing issues in terms of how organizations were responding to the challenge of COVID-19. And those results are included in the, you can find those results on the website. We are about ready to start. In fact, actually it's starting today, where organizations can sign up to join the Sentinel Network if you haven't already. I'm very pleased to announce that Greater Columbia ACH is leading the effort across the state in providing responses as part of the Sentinel Network. We typically do lead, and we beat out population centers like King County and Pierce County and across the state. And so we've always done a really good job of getting Sentinels to complete the survey. Go ahead and next slide, please. So if you haven't participated in the Sentinel Network, here is a link to that, and I think we might be able to provide that link in chat for those of you who want to encourage either yourselves or your organizations or your peers across your local regional areas to complete the Sentinel Network. Again, the Sentinel Network really helps health workforce policy folks to kind of understand and clarify what the needs are. There was a lot of recognition of the shifts that organizations were going through in responding to COVID-19, and that's all documented as part of this effort. We really need to continue that effort. We've had great conversations in our local coalition meetings around the shifts in, thank you, Chelsea, for doing that, around the shifts in workforce demand and how organizations have shifted. All right, let's go ahead and move on to the next slide. One of the other things that we've really done a lot of over the last, I'd say 3 months, is highlighting and reviewing the behavioral health impact situation reports that have come out of the Department of Health. Mary Beth Brown from the DOH has been leading that effort. We've benefited in our ACH region by having some really expert advice come to us in our leadership council meetings, as well as our resiliency campaign that from the Department of Health in terms of how organizations and communities can anticipate dealing and responding to the pandemic. At our coalition meetings, we've had incredible conversations, discussions about how organizations are supporting their staff and their immediate communities in responding to the behavioral health needs. It's been a good effort to consider strategies and options, both not only for our communities, but for each other. And we've had good participation from ACH staff and our local organizations. If anyone is interested in hearing more about those behavioral health impact reports, I think actually Chelsea has access to those. I'm happy to forward that information on to this group if you're interested in receiving that. Go ahead and go on to the next slide, please. Okay, so one of the other major areas that our local coalition has been involved with since March, essentially since March, but it began in May, was really encouraging and entering Operation Unmasked. So we began participating in mid-June, or actually late May, and also really to this date, in surveying retail sites across Yakima County. Now, it's been a really interesting journey leading or helping to lead this effort to encourage masking in our community. And I think we would be kind of remiss if we failed to talk about the kind of the polarities that we all are faced with in encouraging good public health practice. Well, Yakima County, as you know, wasn't doing really well early on. In fact, you can see in this slide, in late May, we had about 65% of our community was unmasked and 35% were masking. Go ahead to the next slide. And so we began to encourage masking, of course, and our public health department was really began to market the essential efforts about masking. And so this is mid-June. We raised our masking rates to 65% and unmasked was 35%. Next slide, please. And you can see by the middle of July, we began and have really kept that place of now we're about 95% masking. And our COVID rates have really significantly dropped. Not completely to where we would like them to be, but they have definitely come down. Next slide. So this is our, this again, just showing the impact of a real broad community effort to encourage masking. I think the real key piece of this has been to make sure that our business community was on board with this effort. And we've had, one of the things that we've done in our leadership network meetings is we've shared stories around what it's like to even to participate in the survey and to kind of get in the trenches around supporting this effort. Okay, next slide. So this is just a graph to show our trends and the difference between men and women over the time. Next slide. And I think we're going to move on to Rhonda talking about the patient activation measure.
So
Thanks,
one of the things, thanks, Dan. So 1 minute, okay. One of the projects that we started before COVID was the patient activation measure, which is an effort that came out of Oregon Health Sciences University. And we had 4 to 5 organizations that were interested in this. Next slide. So this is going to be pretty quick. So, and basically this is an effort to get patients more engaged in their health care, knowing that the more engaged a patient is involved, the less they or the less costly they are over time. So this is the level. This is how patients are measured using this tool. Level 1 being the least engaged, and you can see here what the measurements are. To level 4 being the highly engaged. So we had just gotten started with this before COVID and are just ramping up now even further. And so I'm going to show you just some preliminary results here. So next slide. And so this shows basically the total number of assessments. We do an assessment called baseline, and then we do another one at 3 to 4 months, depending on the organization. There are 4 organizations right now that are participating in this. And again, the tool will measure across time the change in the environment. So next slide. And then on the outcomes, basically, as the progress is shown, then the PAM tool shows an expected outcome and level of cost savings. And so again, this is showing for the 4 organizations that are participating, we're doing a lot of these by telephone right now, telephonic visits that are done by care coordinators. Each organization has a different population that we're targeting. Some are doing chronic disease. Our organization at Neighborhood Health, we're focusing on our patients that are in our medication-assisted treatment program. Others are focused on patients with behavioral health disorders or mental health disorders, and yet others are focused on those with chronic disease like diabetes or uncontrolled diabetes. And so as patients move from level 1 to level 2 and 3 and 4, then there is a predicted cost savings. OSHU has done this, has developed this research program and has been tested this. So you can see on the few that we've enrolled to this time that we've got an estimated savings of $13,000 predicted on this point. So next slide. Oh, good. Okay, so I got in my 1 minute's worth. Okay, so I think now we turn it over to Sharon.
Correct. Yeah, thanks for squeezing that in, Rhonda. And Sharon, you got a little bit fewer minutes, but I think you could still do this by 11:25. That would be great.
You bet. Next slide. So again, this is Sharon Miracle with the Yakima Valley Community Foundation. And this, within the Yakima Valley, we actually provided significantly more funds through GCACH that were allocated and provided to health equity and the social determinants of health. We offered 3-year projects instead of just 2 years of funding. We contributed our own funds to more than match those funds that Greater Columbia provided to us. And this was a great opportunity for us to partner with the Yakima County Health Coalition and our grantees. So what you're seeing in front of you is a breakdown. We received $523,795 from GCACH. We actually had an in-house health equity fund that was completely designated, restricted to health equity that we contributed towards this, and from our own pool of funds, another 164. So we granted over $1 million into the Yakima County and for this 3-year period, and this goes through 2021. Next slide. So this is a list of the organizations we granted to, and you can see the focus areas there. Pacific Northwest University is a medical school. However, they provide a physician and clinic support to the free clinic, one of the only free clinics throughout Central Washington, completely free clinic at the Union Gospel Mission. And it's really and a lot of the folks there are experiencing homelessness, and that was really critical. Yakima Neighborhood Health Services, Housing Justice, the Campbell Farm actually is, and Rhonda can talk to that a little bit later if we have time. Campbell Farm is actually serving our tribal community and the youth there through a trauma and grief recovery program with young children. These are children identified in grade school who are in need of some additional support, and they've lost parents or siblings or something really traumatic in their life. And the folks at Campbell Farm implemented this program with this funding to reach out to those children, and they saw tremendous success just in the first few months with, they had 9 students involved, and some really severe behavioral issues going on in school and in the home life. And with some just initial consultation with children, dramatic improvement and much more communicative and really processing that. COVID greatly impacted that, but we're now, we gave them additional funds through COVID, through our Resilience Response Fund, and they were able to do quite a bit of stuff and reach out and stay in contact. They've now implemented with safety precautions, in-person meetings again with these students, or these youth. So good stuff there. I won't go through this whole list of things that was provided in the report there, but you'll see Rod's House is actually a homeless facility for teens, for example, and they implemented a behavioral health program there. The Homeless Network, excuse me, I said that before. I wanted to maybe talk about, because I'm going to showcase this in a minute. Yakima Neighborhood Health actually implemented a respite bed care program for folks experiencing homelessness, and that has been really well received. Let's see, Habitat for Humanity, dealing with housing justice, Sunrise Outreach, which is behavioral health, but also really supporting our homeless community, and have been really critical there. And Planned Parenthood actually implemented a behavioral health program targeted for teens. So that's kind of who we granted to. Next slide. And just a couple highlights here. So what you'll see pictures of the left-hand side, the Teen Health Clinic at Davis High School. And this is actually in the largest high school in Yakima County and the most diverse high school. And they actually put a walk-in, drop-in clinic. They serve hundreds of students. And when school was in session, really, really high volumes, such high volume that they were struggling. They needed to expand space. And they've actually managed to keep this open during COVID. As you all know, we've got teenagers in the homes who are taking care of siblings and cousins and nieces, nephews, all kinds of stuff. And so this clinic actually provides care and behavioral health care, counseling services to teens and their entire family if needed. And it's still open and working. The respite care I mentioned was actually written up in our newspaper, received some really good recognition. So providing care for respite beds for folks who, are experiencing homelessness and don't have anywhere to go and heal. And so this really helps on recidivism rate back into the healthcare system by having folks the chance to heal in a safe, clean environment. And then this other one is Rod's House. Again, they had to move from their other facility into a church setting, but we've actually provided through a collaborative network with the Homeless Network supplies and PPE and all kinds of stuff throughout this COVID piece to Rod's House and a variety of the other networks. Next slide, please. One of the benefits as this third-party administrator, I mentioned this last time with the GCACH pieces, TPA, is the relationships we've been able to develop. And it was through this funding and the partnership we had with the Homeless Network of Yakima and the Yakima County Department of Health and Human Services that we were able to stand up almost the first week after COVID struck our community, a YakimaValleyNeeds.org website where we assessed and had nonprofits and schools and their PPE and their supply needs and even their volunteer needs, and coordinated that across the entire county. We purchased and distributed really important supplies to essential workforce and folks experiencing homelessness, to all the shelters, the food banks, you name it, throughout the entire valley. And it was a really worthwhile effort and had some really great response. We actually, because of that, we also were able to distribute, gosh, it's been close to 100,000 masks that Greater Columbia Accountable Communities of Health provided to us to distribute through Yakima County. And we're just now finishing up that distribution of that large piece. So, and it's really informed the work of our Resilience and Response Fund, which I spoke to earlier. Next slide. So I did talk about how important it was that we had these relationships built. And so when COVID hit, we actually picked up the phone, reached out to these grantees and the others that we knew and asked, what do you need and what can we do? You know, we had this partnership formed with United Way of Central Washington and LCF. And this same 15-member advisory group advises those grants. We've awarded 81 grants totaling, oops, there's a dot missing here. It's actually $1.3 million in support of Yakima and Kittitas combined. So, and we have more to go. We've raised actually over $1.5 million to bring into our community for that during COVID. Next slide. So this is just to highlight that Lindsay has chosen to share Lyft, who you might recognize as kind of like the Uber ride that was in our community. Through this partnership that we had, we actually partnered with Lyft when it was introduced into the Yakima Valley. And with Rod's House and the Yakima Neighborhood Health Services, we gave Lyft credits to clients needing transportation. And we matched those initial funds. It was really, really successful. And one of the great stories has been Rod's House actually had a youth that needed to appear in court in actually Tri-Cities area and had no way to get there and back. And it was an expensive ride, but the Lyft credit had that individual get all the way there for the appointment and back. And had he not made that, he probably would have had an outstanding warrant for his arrest and gone down a path that was unnecessary just because he didn't have access to transportation. That transportation is also used to get people to and from really necessary medical appointments. And that is actually starting back up now that the community's starting to see the Ubers and Lyfts come back in. Next slide. So I think I'll turn it over to Rhonda. If you have anything you'd like to share, Rhonda, about the respite care services that you all offer through this grant, that would be wonderful.
Thank you, Sharon. You know, I think what I'll share just a brief highlight of it. But first, I want to say, first of all, the Community Foundation has been so incredibly responsive. I don't know what we as the social service organizations would have done without you. So first, I just want to say thank you. On your first slide, when you saw the list of the social service agencies, you might have noticed how many the criteria was housing justice. And a year ago, or a little over a year ago, when the coalition, we did a consumer engagement survey, and we interviewed a little over 500 people at farmers markets and through our outreach efforts, and talked and asked people basically on the survey, what is the greatest need that you have to improve your family's health? And the number one outcome of that survey was housing. And so that's how so many of the grantees were related to housing. Behavioral health was up at the top as well. But I just wanted to point that out. Our respite program that we were funded for, you know, who knew COVID was going to happen when it happened. But before we were able to expand our respite program, we had turned away 75 people last year because of capacity. And for those of you that aren't familiar with medical respite, it's recuperative care for people who don't have housing. So real quickly, since we were funded to expand our medical respite program, we have served 205 patients. And of those, 80 of them were affected by COVID. Since then, we have been identified as the isolation and quarantine program for all of Yakima County. We've been working with our health district and the Department of Emergency Management. So now, you know, and again, without being able to expand, we would have been in a world of hurt. We have 10 beds that are dedicated for COVID, but we now also have the program, thank you. We have the program that was dedicated, that was expanded through the foundation grant. We have 5 beds that are dedicated for non-COVID patients. And so for those programs, you know, for, again, people either coming out of the hospital or people avoiding hospitalization. In the last year, the most common reasons that we've had people in respite have been for abscesses, wound care, cellulitis. We've had 10 people go into medical respite because of our medication-assisted treatment program, and they're typically there for the first 2 weeks of their induction period, when they're first changing from heroin to Suboxone. It's a very vulnerable time, and so our providers have found it incredibly helpful to have people be in a more protective environment while they're going through that first couple of weeks. You may remember, I mean, it seems like a long time ago, but we had quite a hepatitis A outbreak here in the Yakima County, and we've had patients in respite recuperating for hepatitis A. In our programs, it's overseen by a nurse, and patients receive care transitions from the hospital, daily health checks and behavioral health assessments. We feed them, and then provide transportation to their primary care provider and specialty care follow-up. And then, of course, housing stabilization and discharge planning. Our goals in medical respite are to reduce admissions and readmissions to the hospital, and then to develop a discharge plan when they leave our respite program. You know, what we know is that respite care reduces public costs associated with frequent hospital utilization. So it's been phenomenal, the fact that this came to us before COVID, not knowing what it was going to hit. We've been able to work with some of our local growers whose workers have been affected by the COVID pandemic, and being able to house people or give them recuperative care when they needed to get away from shared housing. And then we, again, as an organization, have been able to take advantage of some of the, what we refer to as COVID comfort kits that the foundation has been giving away. We've also received many of the masks to be able to give away to our patients. And so again, you know, the collaborations that we have in Yakima with our partners as well as the foundation have been very meaningful. Thank you.
Thank you, Rhonda. I'm sorry to see you squeezed in again, but that's really good information, and I think everyone knows how to find Rhonda. So right now we're going to take a little break. It'll be now an 8-minute break. We'll be back at 11:35 as the sign indicates. And please don't go away. I want to thank all 80 of you who are still on the line for your perseverance in this. But there's some interesting and exciting developments that we'll hear about both from Whitman County and the Yakima Nation. So stay tuned, and we'll start again momentarily. All right, everybody. Thanks for, again, staying with us. And we are going to go back to the eastern part of the state, or the eastern part of our accountable community of health, and hear from Whitman County. And as you see here, to lead off, Deb Watson from the Whitman County Health Network will be our first presenter. So Deb, the floor is yours.
Thank you. I wanted to start with, I think there's a slide. Yeah, and I just have the single slide, so very simple. Thank you. We're going to begin with the Yakima Valley Farm Workers Dental Clinic. The Whitman County Health Network has been, through a collaborative effort, was able to have the Yakima Valley Farm Workers open up a dental clinic. It was identified in an earlier community needs assessment, the importance of improving access to dental care there in the Pullman area of Whitman County. And they opened up, I think, in late 2018, and pretty early on reached capacity. And just recently they were able to add a second dentist, and are still looking for a hygienist there. The network has also been a founding member of the Pullman Good Food Co-op, which is a small group of people are gathering the community together to open this type of co-op. Locals would like to open a store offering good food from area farmers and producers that benefits all residents, and that also has a offering to present helpful food education to the community. They want to provide equitable access to healthy, affordable, quality food to match local resources with people in need throughout the area. So another step in increasing access to good, healthy foods for our community members. We've been taking a look at disparity data over a number of our monthly meetings, and in kind of the early stages, we have definitely seen some disparities with colonoscopies, mammography, and immunization, and we haven't quite made a decision of which area we're going to focus our efforts on trying to improve those disparities yet. I'd also like to share that the network created and maintains an online resource guide, and this guide can be used for when social determinants of health are recognized, to guide community to this online resource guide in order to see what sorts of resources might be available to help them with their needs. We also have, with the Opioid Resource Network, thankfully Palouse River Counseling took on that role, and they have been funded for a second year. And so the project is much more organized and involves over 36 managing services, which is over their first year target of 30, so doing a great job there. They are predominantly involved with the primary care providers, the hospitals, and the public health department. And along with that type of work, we have some focus in community resilience program and trauma-informed care, and they received some Department of Health funding, and were able to provide educational training that is taking part this month on trauma-informed care, with a focus on the community behavioral health specialists and social workers throughout the community. We also, through the network, collaborate with our practice transformation work. There are at least 4 organizations there in the county working on it, so it's interesting to see that the integrated behavioral health and the patient-centered medical home is spreading throughout that community. The network has also been collaborative in their efforts regarding COVID-19, This includes multi-agency meetings in support of transparent communication, and then systematic approaches for preventing and mitigating the spread. It's including drive-up testing and mass distribution. They wanted to make sure that, organizations and businesses and needed places received the right kind of PPE that they needed in order to care for the community that they work with. Contact tracing is also being conducted, and the county has been in communication with state leadership and has been offered resources should the county need them with the rising rates there in Whitman County, especially related to Washington State University. And through this collaborative effort, just last week, I think, the Palouse Medical and Pullman Regional Hospital were able to launch a new Ready Care Respiratory Center for those experiencing respiratory symptoms and who want to be assessed and tested for COVID-19. This is a collaborative effort to take those patients away from the clinics in the area so that well people going to those clinics wouldn't be potentially exposed. And so it was a great effort and their capacity, they've been seeing a lot of local community in that area. So that was a great collaborative effort that the network was able to help with. The Whitman County Health Network, Becky Heisel is going to go ahead and share some more areas that the network is working on with the funding through Greater Columbia. So I'm going to turn it over to Becky. Thank you.
So I know I'm at the end of the time here for everybody, and I'll try to make this as exciting as possible to keep people engaged. So unlike most other third-party administrators, we are not a community foundation. So as you can see on the slide here, we're the foundation for Pullman Regional Hospital, and we were selected as the third-party administrator for the social determinant of health funding that we received, that the Whitman County Health Network received. So go ahead, next slide. So we really have a couple different projects that we are that we've, I guess, awarded from that money. And the first one is Strengthening Families, the 10 through 14 age group program. And last fall, Laura Raywalt presented. She's the program coordinator for this program. And she presented. It was just kind of, we had just kicked it off, got her on board, and she's doing some great work. We're partnering with WSU Extension on this. And after the first of the year, we did some trainings. We had several facilitators that were trained in different areas of Whitman County. We had just gotten a program up and running in Pullman and one in Palouse, and had plans to do, I think, 3 more, one in Albion, one in Colfax, and looking at one in like the Tico Oakdale area. And then March came along, and we all know what happened then. So because Strengthening Families is such an in-person facilitated program, we had to suspend that program during COVID. And so as of right now, we are working with WSU Extension on how to kind of get that program back up and running, or how we can pivot and still provide the training in different ways. And kind of looking into what we can do to still provide that program or something similar to address ACEs in Whitman County. And so it's kind of on hold, but we're trying to figure figure out what to do next there. And then next slide. Oh, sorry, forgot about this slide. So I already went through this. So the facilitators were trained, like I said, started programs in Pullman and Palouse, plan to begin programs in Colfax, Colton, and Albion. But like I said, those have been put on hold. We're still trying to keep in contact with the facilitators, but through COVID, it's been difficult with the school districts kind of, trying to figure out how to provide education, and the hospital and our different partners, especially WSU, trying to figure out, what they're going to do for education. And so it's been a challenge that we're just now trying to kind of get that back up and going. Next slide. And next slide. The other program that has been funded by Greater Columbia that we are the TPA for is it's to the Suicide Prevention Task Force in Whitman County. And the goal for this task force is to build resiliency within communities. They're holding trainings on mental health first aid. They're developing, interventions and responses. They're providing materials to those trained facilitators, and planning to provide support after, if a death by suicide happens in a community. This is a fairly new program, or fairly new funding that we've received. So they're just now kind of getting up and going. The Suicide Prevention Task Force, though, has been around for a couple of years, and they kind of focus in three primary areas: to distribute materials. If someone tells you they're thinking about suicide, hopefully you have the tools and materials to know what to do. Like I said, providing community trainings and mental health first aid. They do have a trainer who's certified in mental health first aid, and trying to figure out, how that will work in these times, whether that will be a virtual training or if they'll be able to hold, maybe some in-person classes in 2021. And then the third area is to provide training in Whitman County in the Washington Department of Health support team. It's an evidence-based practice that just providing support for behavioral health issues and providing those tools and resources that that community members will need. So, like I said, we're not like a community foundation, so we don't have other kind of areas that we provide resources in. We're primarily focused on supporting our hospital, but also supporting the Whitman County Health Network through these couple different programs. So that was maybe short and to the point, but happy to answer any questions or.
Okay, well, thank you, Becky. And Deb, do you have anything more to add about Whitman County?
I do not, thank you.
All right. Well, yeah, COVID has definitely thrown some of these projects a curveball, and I appreciate your transparency in that, Becky. Just letting us know just how you've had to grapple with that first funded project. All right, well, moving right along, our last presenter is from the Yakima Nation. And Arlen, are you on the line? So can we tell Chelsea whether Arlen is with us or not?
He's calling in, so I can't see. We have a couple callers, but I can't tell who they are.
Okay. Well, we'll just be patient here for a few minutes and just see what might happen with that call. In the meantime, Carol, can you give the group a sense of what's going on with the ACH over the last since we last met?
Oh my goodness.
I already put you on the spot, but I thought it's still
Recapping the month of activities. I just know that Arlen is planning on joining us, Patrick. I know that he was really busy trying to squeeze us in between phone calls. So I imagine, Chelsea, if you wanted to text him, or I could text him or call him to let him know that we're ready. I think he was thinking he was going to be on at 12. So he's probably thinking he has 9 minutes. Yeah, so there has been a lot happening with respect to activities of Greater Columbia ACH. We are very excited about a contract actually that we have now with the Benton Franklin Health Department to help market the new community test site. This is a community test site that helped replace the second National Guard site that had been established in the Tri-Cities. They still have one National Guard test site at the HAPO Center. This is a community test site that's not too extremely far away from the HAPO Center, but it's very close to CBC. In fact, it's called the CBC West Campus test site, and it's been really important to understand who might have COVID so that we can go upstream and do contact tracing and protect others that might have been exposed to the virus. So this is part of the strategy that the Benton Franklin Health District is using to address the fairly high rates of COVID in our region. We also just finished up, Diane Halo is led the charge, and through a marketing campaign that Lauren Noble also helped organize to distribute care packages to seniors in Benton and Franklin counties. And we actually had assistance from Numerica, great assistance from Numerica Credit Union, who helped us advertise the telethon. And we raised over $14,000 to provide care packages for assisted living centers in the region. I'm trying to scramble, you guys that need help. Wes, Diane, Lauren, anybody else that wants to weigh in. We have recently let an RFP to reach out for help to establish a business plan. As you know, the Medicaid Transformation Project was due to end in 2021. So everybody, all the ACHs are scrambling to find that sustainability funding. It does look like, thank you, Sandra. It does look like the Healthcare Authority is trying to get an MTP Year 6 due to COVID. We've already heard how disruptive COVID has been to our communities and trying to get programs off the ground. And so it really wasn't a fair analysis for the program to be so disrupted. So we believe that CMS is going to give the state another year to implement the Medicaid Transformation Project, which is very exciting to us because we are already working on our 2021 budget that includes some new and exciting programs that we hope to take to the board in November. So has Arlen joined us yet? Chelsea?
Arlen, are you on?
And Joyce Newsom, thank you, Joyce, for that. I need your help. We are working on updating our resilience campaign. So it's been so exciting to hear all of these activities that are happening in our region regarding resilience and addressing behavioral health needs. I think we'll have some new partners after we look at our minutes today, but Joyce Newsom was part of the original task force that looked at childhood ACEs. Given the board direction, we are revising that campaign to be more broadly disseminated within the community. We actually asked for feedback from the behavioral health group yesterday that Diane Halo manages, and they are very excited about a public health approach to community resilience. And we're going to need all the help that we can. So I imagine that Diane would appreciate anybody who wants to chime in and help with those efforts. I'm going through the chat here. What else do we need to talk about? Okay. Staff, do you guys have any other updates that we could give the Leadership Council?
Carol, this is Wes. Do you want to talk at all about community health workers?
I think that's a new program that we're still kind of fleshing out, so maybe not yet. We're not ready for prime time yet, Wes. We will be talking to the board about that a little bit later today.
Are there any questions of Carol and the current activities of the ACH by members of the Leadership Council? I'm going to take silence to mean resounding approval, Carol.
Great. I'm giving Arlen a call right now. I'm gonna mute myself.
Okay. So while Carol's doing that, Wes or Diane, do you have anything else to add?
You know, Patrick, I don't at this time. Just a little bit about the COVID test site. We're also providing Pasco some analytic support in terms of being able to assess the numbers that are coming through the test site. So that's a little bit of some additional background that we're doing to support that project.
Okay. Okay.
I did hear from Arlen. He's planning on calling in right now.
Okay, great. Great. Any report from Practice Transformation? Is Sam on the line? Anybody else from Practice Transformation staff on the line? Okay. All right. Well, let's see if Arlen can speak to this. Arlen, can you hear us? Not yet, huh? Okay.
It looks like a caller has arrived. I hope that's Arlen.
Okay. Caller 37, would that be you, Arlen?
Good morning.
Good morning. Thanks for appearing a little bit earlier than planned. We've been too efficient this morning with the presentation. So you have now about 15 minutes if you'd like to take that time, that amount of time to go through your presentation.
Okay. How many are on the call, may I ask?
Currently, we have about 70.
70?
70, yeah.
Is that all?
It's.
I'm just kidding. And but Chuck Meitsky, good morning from the homelands of the Yakima Nation. Good morning to the listeners and people out there. It's a privilege and honor to be able to speak to you this morning a little bit. I must first add, though, that as many of you probably are experiencing and have experienced what we are going through here with the Yakima Nation government, our Yakima Nation people, through these difficult times, and it's been a challenge to try to continue to organize and work on issues involving the health of our people. We have almost 12,000 members of our tribe, and approximately 7,000 of those live within the homelands of the Yakima people. And so far, we've had over 900 of those tribal members that have been infected with the virus. We've had a little over close to 40 tribal members that have passed on because of the virus. And so it has taken a big toll on our people. And but nevertheless, as I told Carol, we nevertheless continue on. And so we've been working on the behavioral health aid program. The first part of the report, we've been working with the Portland area office and Heritage University to implement an accredited BHA program. We've developed a cohort of 6 people to go through the, I'm not even going to try to say the program name, but it is an Alaskan name, to become certified behavioral health aides. The cohort will begin in January of 2021. And we've also been trying to develop legal and protocol frameworks, cross-program patient consent mechanisms, and governance models for Indian Health Service Unit and Yakima Nation PL 93-638 programs, which is a federal contract that we have with the Indian Health Service. And that's to work more efficiently together in delivering care, implement collaborative care models for physical and behavioral health, and coordinating care and other services. The program is called the Commons Project, but has been put on hold again due to the pandemic. Our biggest project is integrating behavioral health and Indian Health Service primary care, so patients' mental health and physical health needs are taken care of. We developed the MOA with and almost ready to place a couple of therapists in the Indian Health Clinic, but again, the current pandemic issue has caused us to put that on hold. But we are working on that. We were allotted funds to purchase equipment such as laptops and hotspots to provide telemental health when COVID-19 pandemic hit. We also agreed to collaborate and partner with various tribal programs by forming a continuing grouping of individuals that consist of sectors such as education, behavioral health, justice, child welfare, SUD, child care development, cultural resources, housing, long-term care, nutrition, insurance, law enforcement, transportation, and public safety, just to name a few, and to identify and review resources to strengthen the local healthcare delivery. Again, many of these projects have been put on hold. I don't know if any of you know, but we were shut down. The Yakima tribal government was shut down completely Monday through Friday for almost a month. We began coming back to work Monday, Wednesday, and Friday from 8 to 12. And just recently, within the last 2 weeks, we've increased those hours 8 to 5 on Monday, Wednesday, and Friday, with various safety protocols put in place to ensure our health, the health of employees, as well as the clients that we serve. And so in addition to those, in addition to that, we have also been working with the Northwest Pacific University, and getting assistance from them for the White Swan Health Clinic and providing services in that community, as well as trying to get started a mobile clinic to provide health services along the Columbia River. As many of you know, we have 10 million acres of ceded land where our tribal members live, and we continue to try and work in the delivery and identifying essential workers from Northwest Pacific University. We are also in collaboration with the Fred Hutch Cancer Research Center. We are collaborating to do a additional COVID-19 assessment that will help us identify the impacts to our community, specifically our elders. We are currently doing a survey, a cancer assessment survey, as well with that group. So so those are just a few of the things that we have been doing and we've been trying to do. Again, the behavioral health program is continuing to service clients through its program, as well as providing other preventable health issue work that is going on with their community. So I don't know if that suffices our report, but that's all I have for today.
Okay. Arlen, I assume that you have received funding from Greater Columbia ACH. That's correct, right?
Yes.
Okay. And that's gone to the activities you just touched on?
With the behavioral health program, yes, through them. They are the ones that are coordinating that effort.
Very
the
good.
Yakima Nation Department of Human Services, it works with the behavioral health, and they collaborate and with the working groups so far when they started. But again, you know, I don't want to make any excuses, but it's just something we can't help in terms of the pandemic. But
Right.
yes, we are receiving those funds and working to ensure that we continue to try to work on the goals and objectives and the mission and intent of that fund.
Very good. Okay. Anybody on the line have questions of Arlen?
Patrick, this is Carol again. I just wanted to tell Arlen that, you know, we probably watch more TV now than we used to, but we've seen these wonderful ads that have come out about Legends Casino, and they are just, you know, during the pandemic, they were very heartfelt. They were a wonderful demonstration of the compassion that the Yakima Nation has for the community in terms of wanting to keep everybody safe. And so, Arlen, I just wanted to tell you how much every time I see one of those ads, how they touch me because they're very heartfelt and very compassionate advertisements. And we're sorry for the losses that the Yakima Nation has endured through this pandemic. And thank you for being our partners in this.
Yeah. Well, certainly, and it's not just working with our tribal members. We have a lot of community people, non-native alike, that live within our reservation. And so trying to address the awareness, the education, we were able, and we also purchased a total of 4 new ambulances for our Yakima Nation ambulatory care EMT people. We bought 4 new ambulances, and 2 of them we were able to move and house down here in the Toppenish area from White Swan. And so that really increased the I guess good feeling that you're talking about in terms of, you know, educating and letting the people know that they were being cared for and that their health needs were being addressed more so by us being able to open up a unit here in the Lower Valley in Toppenish to be more rapid in their response to medical needs. And so the elders really feel comfortable now because it's right next door to them. And so we've been trying our best to, but the ambulance service also services Fire District 5 within our county, and they rely on those ambulances for calls as well. And they are the first responders. So, I mean, you know, we're doing a lot of things to, you know, do the best we can to provide that service to the public.
Thank you.
Okay. Any other comments or questions for Arlen and the Yakima Nation's work on social determinants and life of the prospects of healthcare delivery and COVID times? All right. Well, folks, we may be way ahead of schedule, way ahead being 20 minutes, but before I sort of sign us off here for the day. And again, thanks to all for staying the course. Any quick comments about what you've heard from the various corners of the ACH?
This is Ronnie Batchelor. Do you hear me?
Yes, Ronnie.
I just want to say that the work that's being done across the board is just fantastic. It's great to hear about boots on the ground. It's great to hear about the housing respite. All of the presentation today has been amazing. And I want to thank each and every one of those presenters, including Arlen, for being here today and bringing such caliber of work to fruition. So that's me. I'll talk to you guys later.
Thank you, Ronnie. Yeah. Anybody else have some comments they'd like to share? Well, I'll as your facilitator, I'll just say that like last year, I've been very impressed and inspired actually by what I've heard today. All the different levels of activity, the many ways that the 9 counties are approaching the challenges that we face, and reminds me of something that China tried in the mid-1950s, and it was called "Let 100 Flowers Bloom," and it was the first time in that country's recent history, anyway, where there was a liberalization of efforts, of activities, and ideas, and it spawned a wonderful renaissance that unfortunately was short-lived, but nonetheless, it spawned a renaissance of activities and ideas that I think inspire some Chinese people even today. And I would hope we would walk away from the meeting today with some inspired moments of what we heard. Not that you'll immediately shift your activities to one of those ideas, but I hope there was enough cross-fertilization that some of that might happen over time. So,
Patrick?
Yes, who's this?
This is Rhonda.
Hello, Rhonda.
I guess the comment I would like to make is what I really loved about this was, speaking from a board member, is that each community, again, sort of going back to, remembering when we talked about this a couple of years ago, was these projects were in response to consumer engagement. And each county had the ability to involve their consumers, identify what the priorities were, and respond to the needs of their individual community. And we, are varying sizes, various needs, and this is the product of the response through our individual communities. And I think it's just amazing. There were some common themes, but some varied differences in terms of responding to those communities. And that, to me, that's very exciting.
Well said.
Patrick, this is Joyce with 211. I just wanted to say on behalf of Washington State, 211, we really appreciate all these new resources coming into our communities across the board. It definitely makes our job a lot easier when folks are phoning us for those critical resources. So again, thank you for all of you for serving your community so well.
That's very good, Joyce. Thank you for that perspective. Anybody else have some general reactions to what you heard today? All right. Well, then I think we will call the meeting closed as of now. And just to remind you, there will be a November meeting, but not a December meeting. And the November meeting is going to be a real meaty one, so to speak. It's going to be on value-based payment, which was really at the core of I think what so many payers are looking for in healthcare reform, whether it's for Medicaid or other parts of the healthcare universe. So I hope you'll all come. It should be a very good meeting. I know that staff is working real hard to make this worth your time. So with that, I think I'll sign off unless our executive director wants the last word.
Oh, I thank everybody for joining. It was a great sharing of information, and I think that a lot to chew on.
Yes, indeed. So I hope you'll all feel ready to contact those people whose presentations piqued your interest. And Chelsea, these presentations will be on the website relatively soon, will they not?
Correct.
They're
Good.
already on there, so feel free. The minutes should be up within the week. And the
Okay.
recording.
Okay, they're already up there. Okay, well, everyone have a good rest of the month. Hope we have some warm days left for those of you who are still growing gardens like myself and keep those tomatoes ripening. I hope Halloween is a safe holiday for all of you and your families. And we look forward to meeting again in mid-November. With that, we're adjourned.
Thanks, Patrick.
Thank you, Patrick.